I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. Today, I have a really cool guest, Rebecca Enders. Welcome, Rebecca.
Thank you for having me this morning.
So, Rebecca, let's talk about what you do in the field of supports and services for people with intellectual and developmental disabilities.
Yeah, so I am a board-certified case manager. I am a director of case management for Optimal Healthcare. We provide case management for all 4 regions across Maryland, and we are working on our CCS. We support our CCSs in providing case management.
So, just so we're all on the same page, what is case management in this field?
In this field,
Yes.
Case management is the coordination of services for individuals with intellectual and developmental disabilities. We also provide and support for individuals who are dually diagnosed. We work with individuals across the lifespan, helping them apply and be eligible for DDA Medicaid waivers. And if they're not, we can also help them with community coordination. We work very closely with different agencies to support individuals who are forensically involved going through the criminal justice system. Mm-hmm. We work with school coordinators to help children transition into adult services. And we really ensure that not just the individual, but the families and their networks are provided the supports to be integrated into the community, into their community, and that they have independent and meaningful lives and what matters to them most.
Well, that's a mouthful, and it sounds like a lot of work.
It can be. It's very rewarding.
Yeah, sometimes challenging things can also be extremely rewarding, right?
Very.
Yeah. So, how long have you been doing this?
I've actually only been in this field for 3.5 years.
Okay.
Prior to that, I was in education for 15 years.
All right. And how did you end up working in the field of intellectual and developmental disabilities?
I really came across right after COVID. I think we were all reevaluating how we can best support individuals, especially those at most risk. As I said, my background was education. I was a special education teacher and a program director for a non-public school all across Maryland. And with the climate in education and the politics that were coming in, it was becoming very difficult to support the staff that I was working with. But I knew I still had that passion to help others. And I just really felt that my heart and desire and my special skill set of being so empathetic and understanding and resourceful could be utilized in another aspect. So I joined Optimal Case Management as a brand new coordinator of case management, and quickly learned how wonderful and meaningful this work is. And through the Optimal Case Management, I was promoted throughout the ranks, and in 3 short years as a director of case management for one of our largest regions.
Wow, that's pretty impressive.
Thank you.
You know, you mentioned the rewards of doing this, and one of the reasons I like to do this podcast is to help people to understand this field better and to see it as a place that you can have a wonderful career.
Yes.
And do a lot of good work, and it can be very rewarding and very fulfilling. Do you have any particular areas that you just really like about case management, that you find exceptionally rewarding, or maybe even a story?
I think this might surprise a lot of people. My passion is data analytics, and really seeing how those numbers can make an impactful difference. Seeing that there's a gap in the industry, and using data and numbers to be data-driven to make wise decisions that are scientifically proven and can help not just one person, but a community at large.
All right. How are you doing that?
So I have developed, it's called Atlas Acuity, and it stands for Tiered Level Supports. So case managers, not just in our work area, but all across America and the world, when they have a caseload, it's sometimes arbitrarily assigned 30, 40, 50, and no one could tell me why. Why does this case manager have 40? Well, they're more experienced. What does that lead to? Burnout. We know that the quadruple aim is huge. We really want to focus on reducing case manager burnout or clinician burnout. We want to reduce costs. We want to improve the overall patient and clinician experience. So I saw that gap, and I took my data and we provide support and services for over 2,000 individuals across Maryland. I looked at how much time our current case managers are spending. And time is our most valuable asset.
Sure.
And that's what the most vulnerable need. They need our time, but they weren't able to get that because our caseloads were so full on that day to day. So I looked at how much time per month was being spent, aggregated that data using standard deviations, and I then looked at what services and supports do all of these individuals have in common, from either just receiving community coordination or being directly in services. So there are 16-point matrix. Each point is weighted by a 10. So for each point that they have, or support or service that they need and require, gives them an acuity score. The acuity score can go from 10 to 110, and for example, if the individual has community coordination, they're in services, so they receive quarterly monitoring, maybe they receive behavioral support services, they receive dedicated one-to-one, and they also need nurse delegation. That would give them a score of a 50 on the acuity. That equates to time, 1 hour and 15 minutes per week on average for an individual who has that many supports and services. So taking what time each individual needs to then build up to the CCS's or the case manager's caseload, their score of what they need to have a full-time caseload is between 1,050 and 1,400, which in time equates to 32 and a half hours. We know the average work week is 40, so they spend 32 and a half hours just on targeted case management, providing that necessary support for the individuals. It also allows them to have the necessary time to complete the very important paperwork that comes along with being a case manager. So we're able to balance the caseloads and look at acuity as a moving number. It's not stagnant. As people's needs change, their acuity score goes up. As they become more independent or they've reached goals, their acuity goes down. So when we are assigning individuals that are coming into our company at Optimal, we are able to say, okay, this case manager is in this area, but what's their acuity? Do they have the time? No. Let's look at the next one. They have time. And we could also ensure that case managers aren't just having all crisis cases. They have a mix. They have someone who receives behavioral services. They may have someone who has been in services for 40 years and is doing great and thriving in the meaningful day. They need less support than someone who is going through the criminal justice system. So it's really important to look at the person, not the diagnosis, and what supports they need and how much time they need every week.
Okay. Wow. And that is a lot of data, and yes, you're very fluent in data. That's very clear. This is really impressive, and yeah, sounds like it can certainly improve efficiency,
yes,
and reduce burnout, as you said. And when people are less burned out and less overworked, they're going to provide better supports and services, and it's
yes,
going to be beneficial all the way around.
Absolutely.
How long have you been using this model that you developed?
So we've been using the model for close to a year. It definitely has been a passion project of mine that I've been working on since being with Optimal, that I love that we saw a need in the market and I was given the opportunity, the tools and the support to develop this. So we are still very new into Atlas, and every day I'm learning something new. How can we improve it? I'm currently working on automating all of the data dumps within our EHR system so that it is updated daily. At the moment, it is updated as that need changes by supervisors, so it's very people-driven. We really like to be process-driven so that there's no errors by humans, because we are humans. And the next step for Atlas would be to then see how we can get caseload acuity for supervisors supervising those case managers as well.
What's the next step for Rebecca?
The next step for me is definitely to just continue working on Atlas, to fine-tune it, continue seeing how these numbers are impacting our case managers, the satisfaction surveys that we've gone out throughout our company, a lot of the feedback has been that I have more time with my individuals, I have more time to do my administrative tasks, and I'm really excited to be working on some other projects with Optimal, just looking at how technology is really a big part and how we can incorporate that to also decrease the time we're writing activity notes. So utilizing AI generations within our EHR system to be person-centered, but also cutting edge with the technology and keeping up.
Yeah, do you have any concerns about AI and maybe it's a little too easy sometimes? And
yes, I definitely was that way until I started doing research and understanding that the more you use it, the more it's tailored towards you. Excuse me. But you do have to be careful that you are not just taking it face blank. Every system, every state agency, different providers are going to need different aspects for a case note or how we're using AI. And it shouldn't be a one-stop tool. It is a support that we can use to help guide and keep us on the path to making sure our case notes give all that detail, but it shouldn't be the only thing we're doing, because as humans, we are able to put in that emotion and that heart that AI can't do yet.
Good advice there. So I know people are going to have questions about what you're doing and want to reach out. Is there a way that they can reach out?
Absolutely. They can go to our company website, ohc-inc.com. On there is how to contact us, or they can email me directly at renders@ohc-inc.com.
So that's RENDERS at OHC-INC.com. Okay, just wanted to spell it out. All right. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. What are 3 tips, 3 words of wisdom, 3 pieces of advice that you'd like to share that you think can improve supports and services or the world, or health and wellness for people with intellectual and developmental disabilities?
It's a really great question, and I think I will give the advice that I give to my peers, my colleagues, and sometimes to myself. You can't pour from an empty cup. We do work in this field because we have a passion. We are amazing at what we do, but it's really important that when we're caring for others, we're caring for ourselves first so that we can be that best version for who we are supporting, whether that be an individual that we're providing case management services to, we're in the community volunteering, whatever that may be. Really make sure that your cup is full first. And then help others. That would be always my first one.
It's like put your own oxygen mask on first before.
Yes. Yeah. And I always envision it with a cup of tea as well. Make sure that your teacup is full. The second one is know the why behind why you're doing something. I think that sometimes we can be misguided. We follow the larger majority, but why are we doing that? And that's really what speared Atlas. Why are we doing caseload assignments this way? There could be a better way. So knowing the why behind everything that we're doing, and then also advocate even when no one is watching.
That's really important, the things that you do in private, right? Yeah.
Absolutely.
Yeah, I love that. Rebecca, it's been a pleasure talking with you.
Thank you. You too.
I'm really excited to see where you go with this and what you're developing, and I think there will be a lot of interest in it. And I thank you for taking the time to talk with me today.
Thank you for having me.
More importantly, for the incredible work that you're doing in the field.
I appreciate it very much.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.